What's going on, guys? Tony Maritato here, physical therapist, and welcome to the Total Knee Replacement Support Group YouTube channel. I just took a minute to step outside and enjoy this gorgeous fake spring day. It feels amazing here in Ohio. I hope wherever you guys are, you're having such a nice day. So I wanted to answer a question that came up in the clinic earlier today. A patient was asking me, how do I take care of my incision? Is there anything I can do to help it heal better, heal more quickly? And I just wanted to address a couple questions. Now, I am by no means an expert on wound care. We have a couple amazing wound care specialists in the knee replacement group. So if you have questions about specific wound problems, go ahead and ask on YouTube or in the group, and I'll see if I can coax one of them to come on live and answer your questions. But I can give you the general idea. So we know, now I'm 46, I turned 46 last month. If I get a paper cut on my finger, it feels like it takes an eternity for it to get better, for it to heal and close. You understand the severity of the incision that it took to open up your knee to provide the replacement. So if you look at the clinical research, it typically takes 6 to 8 weeks for the healing to occur for a surgical incision that's been appropriately sealed. Now, whether it's staples, whether it's glue, whatever the surgeon used to close your incision, 6 to 8 weeks is the standard. But I would ask you to consider other health factors that come into play. Age, healing, health, nutrition. We know that an individual with type 2 diabetes will heal more slowly than an individual without. We know that an individual who smokes will heal more slowly and potentially have more complications than somebody who doesn't smoke. We know that blood flow and circulation is vitally important to tissue healing. And so that brings me around to, I've got other videos on the channel, you can go find them, but don't just think about your physical therapy and your exercise as a component of healing your knee. Think of it as a component of healing your body. You need to exercise for general health, general well-being, to manage your hormones, to help you sleep better. Sleep is a huge topic. Hey guys, I'm live, so if you guys want to post a comment or a question, I'm on for about 10 minutes today. But I was just saying that exercise away from the knee joint, upper body exercise, cardio exercise, things that make you feel good, whether it's yoga or Pilates, any other exercise that gets your heart pumping is going to benefit the tissue healing in the knee, specifically associated with the incision. So consider 10, 15, 20 minutes a day of exercise, not even dedicated to the knee, just general, the rest of your body. Get it moving. Get out and get some sun on your face, on your skin. Yes, we want reasonable, responsible skin exposure. Hey, Scott. Wow, from London. Thank you so much for joining. We want sensible skin exposure, but we know that vitamin D is vital for tissue healing and for general health. We know vitamin D receptors have been found in multiple parts of the body. So I would encourage you that if you're in a climate that allows you to get some exposure to the sun, get out there and do it, but do it responsibly. Talk to your dermatologist if you have a history of skin problems and skin cancer, but figure out a way to allow that light to help you heal the body, right? So we talked about circulation. We talked about factors that could limit healing, like diabetes, hypertension, age. We talked about general exercise, vitamin D, and really it's just gonna be keeping the surgical site clean, free from debris. Hey, buddy. Look at, there's some research that suggests keeping it covered might help the healing process a little bit better. Those of you who want to use lotions and creams and stuff like that, I would encourage you to at least wait until the incision is fully sealed so there's no openings. Nothing would be worse than using a product that you think might help you heal, and in fact it ends up introducing an infection. So typically the advice is no topical creams that weren't prescribed by your surgeon or physician until the incision is completely sealed. Now, I shared a video either yesterday or today regarding scar tissue massage and mobilization. Hey, Michigan, you're right up the road. I'm here in Ohio. I'm gonna do a couple videos we'll line up a couple sessions here where I'm gonna do some cross fiber massage, scar tissue mobilization, a couple things that I use specifically in the clinic. I've got videos on the channel talking about suction cups and talking about massagers. Oh, Anna, thank you so much. That's so sweet. I really appreciate that. You know, it's hard to come on here. I had some time out of the clinic. I was in the clinic this morning and I'm going back this evening. But I really appreciate all of your support, all the great things that you guys post and share in the group. There's my little buddy. I had to let him out for lunch. Anyway, keep it clean. There's some research that suggests keeping it a little bit moist will help, but obviously you don't want to introduce moisture. You just want to keep it covered and clean and not let it dry out. But if you have specific questions, if you're dealing with some issues with tissue healing, reach out to some of the specialists that are in the group. They're physical therapists who are specially trained as wound care specialists. These are the experts. These are the people that I go to when I have something in the clinic that I just don't understand. Otherwise, if you're somewhere where you can get outside and enjoy the beautiful weather, go do it. If you're not, I wish you the best and I appreciate all of your support. Like the videos, subscribe to the channel if you haven't. Yeah, of course. I wish I could. I wish I could come out there. I'm gonna get back inside. I'll catch you guys later.